Hi, this is Dr. Chandra. I'm a consultant physician in New Delhi, and I'm the principal medical advisor to the European Union in India. A few key points that need to be discussed in regards to the second wave of COVID that seems to have hit us. First of all, I do believe that the virus seems to have mutated quite a bit, which is also the reason why the RT-PCR test seems to be unable to detect it. I have patients coming in with multiple signs and symptoms who are testing negative, but eventually their x-rays and chest CT scans are showing certain signs of COVID, like ground glass opacities. So what is it that we need to do now? First of all, if you have symptoms, please quarantine yourselves irrespective of the test results and when you're waiting for the test results. Watch out for new symptoms of the disease, particularly the mutated virus is showing multiple symptoms like abdominal pain, diarrhea, rashes, headaches, bluish discoloration of the hands, of the fingers, and of the toes. There's conjunctivitis. There are, like I mentioned, there are rashes. Plus, there is confusion of the brain, a bit of a brain fog, sore throat, of course, along with the older variety. So you have fever, body ache, etc., cough, breathlessness, all of these together. Watch out for these new signs and symptoms. Now, apart from these new signs and symptoms, you also need to be careful as to when to rush to the hospital. Keep a few simple points in mind, considering the fact that our healthcare infrastructure is almost collapsing. There's no place in the hospital. There are no beds. There is no oxygen. Monitor your signs and symptoms. Speak to your consultant physician. Speak to them so that they can start a teleconsultation and start your treatment at home. If your oxygen saturation goes down to below about 92% for more than 2 to 3 hours, irrespective of deep breaths, that's when you need to go to the hospital for oxygen. Also, if your fever does not go down to about 102 degrees Fahrenheit, irrespective of taking paracetamol for multiple doses, that's when you would need to go to the hospital so that your fever can be taken care of. You need to know that the disease is inflammatory in nature, so basically all parts of your body are inflamed. So you will experience body aches, headaches, pain in the chest, pain in the joints, muscle weakness, terrible lethargy. However, all of these can be symptomatically treated by your doctor at home. So it's only if your oxygen saturation drops or if your fever is out of control for a few days, that's when you need to go to the hospital. Okay. Apart from that, just hang in there. We'll get through this like we did the first wave as well. Thank you.